Welcome to Falling Through the Cracks. Feel alive and thrive with Dr. Rebecca Risk. Do you ever feel that even though nothing seems seriously wrong and you pass all the medical tests, that you still feel that your health, pain, and fatigue are completely out of control? It doesn't have to be that way. Listen to the tips and suggestions given on our program today and take back control of your health. Now, here is Dr. Rebecca Risk.
Hi, everybody. Welcome to Falling Through the Cracks. Today, we're talking with Maya Dusenbury. She is a freelance writer, editor, and author of the book Doing Harm, The Truth About How Bad Medicine and Lazy Science Leaves Women Dismissed, Misdiagnosed, and Sick. Maya, welcome to the show.
Thank you so much for having me.
And I've already told you several times how much I loved your book. Still do, of course. But it was just so it was so fascinating. Like I wanted to do a show on this topic, and I thought it would be hard to find something. And of course, your book having just come out, it was perfect timing that I was looking for someone like you. So thank you so much for bringing this information into the forefront, so everybody can understand what's actually happening.
Yeah, thank you. I think it's definitely past time for a book to sort of pull together. I think research that supports what a lot of women sort of know from their own experience, for sure.
Well, you know, I having struggled with looking for a Lyme diagnosis, of course not knowing for 14 years, I thought that I didn't realize how I was treated was actually also part to do with my sex. It hadn't occurred to me, because now treating people with Lyme, it is men and women that have these stories to tell that are so similar to what I experienced. But with what you say in your book, this, although can happen to men, happens to women way more, as the studies show.
Yeah, absolutely. And I do think it's one of those things that it's hard to pick up on that sexism when you're just one individual moving through the medical system and really only have your own experience to kind of look at, and it's easy to say, you know, maybe this was just a bad doctor, or, you know, how can you really tell if a man would be taken more seriously? So I think it really does kind of take starting to hear these stories from many people and look at the research to say, you know, yeah, there is sort of a pattern here. And as you say, it does affect men for sure, and especially in a disease like Lyme, but there is that additional burden on women.
Well, and you talked at one point about somebody who had collected stories about, I think it was chronic pain, and women weren't believed, and then they couldn't get help. And most of the men that were interviewed were believed, but they still felt the hopelessness of not being able to get help because there's not a lot of help for what they were experiencing. But at least they had the affirmation of their doctor believing that they were experiencing what they were, which is different than what women experience.
Yeah. And I think, you know, it is important to note that certainly men with chronic pain or other really poorly understood conditions that mainstream medicine just doesn't have a lot of help for any patients with those conditions. You know, obviously there's sort of the frustration of that and the suffering that comes with that. But then, yeah, as you say, this is this sort of additional frustration of just not being heard and not having your pain at least taken seriously and believed as real.
Which is disheartening. But, you know, I want to go to, I ask everybody this question: what inspired you to write this book and research this topic? So can you just give us a little bit of background of what drew you into doing this? Yeah.
So my own experience sort of prompted me down this path a little bit. I was diagnosed with rheumatoid arthritis about 5 years ago, and before that had been, you know, very healthy 20-something, and just really hadn't had too much need to interact with the medical system. And so although I'd been a feminist writer and had written a lot about reproductive health issues, it really wasn't until I got sick myself with RA that I started kind of thinking more broadly and about how sexism affected medicine, and really sort of realized that as a healthy person, it just had been really off my radar, and even as a feminist, felt like I didn't have a really good sort of understanding of the history and the context to sort of start understanding a lot of what I was learning once I started diving into learning about autoimmune diseases and my own experience actually getting diagnosed. That was pretty easy and straightforward. I was taken seriously, and I got diagnosed pretty quickly. But I started learning that so many other autoimmune patients do not have that journey, and go see many doctors over many years, and often report really feeling like their symptoms were dismissed or brushed off as stress during that time. So the book kind of was in part kind of just an attempt to understand why stories like that seem to be so common.
Well, and they are, and I think that the important part for people to understand, because this is a big part of your book, is the history of why we're talking about women in this aspect and how this is still affecting women. But you talk a lot about the history of hysteria, and I think that's really important to note. If you can just explain that for us.
Yeah. So I think when I started researching, and started hearing sort of stories from a lot of friends who, had West Nile and were told to go see a therapist, or, heart pain and were told it was anxiety. Stories like that, I think initially I felt like, this is just yet another area where women's voices and women's testimony about their own experiences is just not being granted the same authority as men's. And of course, as a feminist writer, I was not surprised sort of by that. But as I really kind of dug into that medical history and this history of hysteria, I realized that there are these kind of deeper roots within medicine, more particular reasons that women's reports of their own symptoms are so often kind of brushed off as all in your head or psychological like that. So, the history of hysteria, which is a long one, so hard to kind of condense, but this was sort of this label that for centuries, if not millennia, was kind of given to any mysterious symptoms in women. And in ancient Greek times, it was attributed to a wandering womb throughout the body, and then by the 17th, 18th centuries was starting to be seen as sort of a nervous system disorder. And for a long time it was considered, a real physical disease. But then after Freud, as psychiatry kind of became its own specialty, there was this pretty radical shift to seeing it instead as a mental disorder that causes physical symptoms. And sort of ever since then, so for the last century or so, we've had kind of different labels to apply to psychogenic symptoms, so symptoms that are thought to be produced by the mind. And so the term hysteria itself is no longer, an official diagnostic category, but there are these different other terms like somatoform or psychosomatic or conversion disorder, that have kind of taken its place, and this concept has really remained alive and well. And it's always been the case that women have been kind of the stereotypical patient with hysterical symptoms. And so I think that really kind of helps explain a lot of why women, so often find their symptoms psychologized in this way, which is a trend that women have been complaining about since, at least the 70s, saying, this happens. And I think it was interesting to me to see just how this history of hysteria, which kind of, I think we assume is very firmly in the past, is really still very present, and the legacy at least lives on in the way that doctors kind of perceive women's symptoms.
Well, it's really interesting to talk about this history, and then like reading your book, understanding that women actually are affected by autoimmune diseases more and by pain more, and we actually most likely have, I would say more than most likely, we have legitimate issues that we're going to the doctor for. And I think if I remember the stats right, you said it takes 5 to 10 years to get diagnosed with an autoimmune disease, and not because the women aren't relaying their experiences to their doctor, that their doctor isn't even believing them.
Yeah, exactly. I think the stat from the American Autoimmune Related Diseases Association is these days it takes 4 doctors over 4 years for an autoimmune patient to get diagnosed, and it was even longer several years ago. But yeah, and I think autoimmune diseases and chronic pain conditions and a lot of these conditions that do disproportionately affect women tend to be ones that cause subjective symptoms like pain and fatigue, that doctors don't get a lot of training on how to diagnose them, and so the result is that often you have a woman who's complaining of these symptoms that can't be kind of objectively confirmed via a test very easily, and so it becomes a great risk that she'll just be kind of seen as stressed or tired from work, or and especially then because doctors aren't getting great training on something like autoimmune diseases, that just kind of compounds the problem where there isn't a specialist in autoimmune diseases, and so often patients are kind of referred all over the place, and it becomes unclear who's the expert to really turn to, and a lot of women just fall through those cracks.
Which is why the title of my show is Falling Through the Cracks.
Exactly. Yes.
You had that line in your book. I thought, oh, this is perfect. And that's exactly how I felt for 14 years. And I thought it was mostly because Lyme, of course, is not accepted by mainstream medicine at this point. But I was 21 when I started looking for a solution to how I felt. I was very sick, and I was told that either I had anxiety or I was young and I would get over it. And then when I turned 30, I was told, well, you're 30, so this is the way you're going to be. And I was sicker than I was when I was 21, told that I would grow out of it. And it didn't make any sense to me. And I said that to one specialist, and he said, well, that's not the right response, but I can't help you. And this is probably just normal for you. So I still couldn't get help when he acknowledged that wasn't right. And I, from your book and from accounts that I hear, this is very common that, we're not even functioning in our daily lives, because I was not. And it's just like, oh, well, this is the way you are. Off you go. And not offered anything, which is not right.
No, yeah. And I think, your experience seems to point to this other sort of tendency where if women's symptoms aren't kind of brushed off as all in your head, they're often really normalized. And this, of course, really happens with any sort of menstrual pain or pelvic pain. Women get told, it's just normal menstrual cramps. But I think it sort of extends just kind of throughout women's lifetime where, it's, oh, you're young, maybe it's just a hormonal imbalance kind of vaguely attributed to like hormones. And then, oh, you're pregnant or you're postpartum, it gets attributed to that. And then by the time you're going through menopause, that becomes another convenient thing to blame a wide array of symptoms on. And it really becomes this thing where somehow women are treated as if it's just kind of normal for them to be very sick, and even sick to the point where they're not functioning.
Well, yeah, which is not right. And I think the other opposite of all of those comments, which you bring up in your book as well, is, well, you've delayed having children, so you should just find a partner and have babies, and then you'll be fine.
Yeah, exactly.
So we can't win because we have babies and that's our problem, and we don't have babies and that's our problem. And even if that is what's going on, those are actually, like, postpartum is a very serious condition that often does get ignored as well. And I think that all of these things, what a lot of us experience, aren't normal. They're just common. And that doesn't mean that they should also be brushed off if the case is what they're talking about.
Yeah, absolutely. I think that's a great point, and certainly something I discussed in the book when I talked a lot about endometriosis and menstrual pain, and how, even not just within medicine, but in the culture more broadly, we've kind of accepted that at least a degree of pain with menstruation is normal. And I think we really do need to question that and say, why it's certainly common, but just because something's common does not make it normal, or doesn't make it inevitable, and doesn't make it something that we shouldn't devote research and time into investigating and trying to see if we can turn that around.
Yes, exactly. We're going to take a quick break. We're talking today with Maya Dusenbery. She's the author of Doing Harm, so we'll be back shortly.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
The largest syndicated alternative health talk program has come to the Voice America Network. The Dr. Bob Martin Show is the program that will answer your health questions and help you to heal your own body of many different ailments. Each week, you'll hear the answers that Dr. Bob gives to his callers that help them to be their own doctor most of the time. We'll also discuss developments on the healthcare front and what you need to do to keep your body in top form. The Dr. Bob Martin Show airs Wednesday mornings at 9 a.m. Eastern, 6 a.m. Pacific on Voice America Health and Wellness.
The Voice America Live Events channel is here now to showcase your corporate, individual, or organization's live event. Visit voiceamerica.com/live events to see all of our past live events and find out more. Whether it's a multi-day conference, special speaker, or single-day event, we've got everything to make your event a success. We can do a few hours or a few days. For more information about taking your event to the next level, call Jeff Spinard at 480-294-6417 or email info@voiceamerica.com. Again, that's Jeff Spinard at 480-294-6417 or send us an email to info@voiceamerica.com. Voice America is where you are and where you want to be. Join us around the globe as we broadcast live from some of the most interesting events available. Don't forget to view all our live events, including on-demand access to past events that you may have missed by visiting voiceamerica.com/live events.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back. Today we're talking with Maya Dusenbery. She's the author of Doing Harm. So, Maya, I want to just tell you a little bit about why I sought out this topic. I hadn't, like I said before, I hadn't realized that my experience had been partly due to my sex in doctors' offices. And when I interviewed Abby Norman in March about her book, Ask Me About My Uterus, and she touched on the topic of how doctors aren't taking women seriously, and I started to see that more and more. And then I had a week in my clinic where I had one patient who went to emergency with pelvic pain and was very calm and said, I'm in pain and it's very severe, and was told it was anxiety and sent home. And then I had a male patient who in that same week went to emergency saying it was anxiety, and they looked at him and they did a pelvic CT scan and an MRI and a bunch of testing, and then in the end went, oh, maybe it is anxiety. But he got all the testing that the woman needed, and I thought, this is such a weird overlap. And he went in saying full on, I've been diagnosed with anxiety, I can't handle my life right now, please help me. And they did all of this imaging and everything because, from what I gather in your book was they didn't believe that a man could be experiencing anxiety the way that he was, and there must be a physical cause. And the woman didn't even receive any of those testings at all.
Wow, yeah, that's a fascinating story.
And in your book, you talk a lot about how this is very common, and I wanted people to understand this because I think it's important for us to know, because having that education of how to approach our doctors and what to do is very, very important for women to understand that we actually may have to shop around, and it can be serious what we're experiencing no matter what we're told.
Mm-hmm. Yeah, I do think it's really important to. I hope one of the things that my book can do is just by providing that background and history and context, give women a kind of understanding about why those things happen. Because I do think for a lot of women it becomes really kind of confusing and shocking to enter the medical system and not be taken seriously or be told, it's anxiety in a case like that. Because I think especially for younger women like myself, I'm in my early 30s, and I have sort of grown up with an expectation that, we've made great strides when it comes to gender equality, and that my voice will be taken seriously in any realm that I enter. And so I think I heard from a lot of women my age as well who felt really kind of shocked to realize that their symptom reports were not taken seriously. And often it is hard to kind of trace it back to sexism sometimes. But a lot of women kind of spoke to just feeling like there were these stereotypes at play that seemed to be impacting them that they didn't quite understand but could certainly feel. And one of the saddest things I heard was so many women who kind of spoke to feeling like they needed to bring a male partner or a father or even a son with them to appointments to kind of vouch for them and to bolster their credibility in that way. And often found that when they did that, they actually were taken more seriously and their symptoms were treated as more real and credible.
Yeah, which doesn't make sense.
Yeah.
I often recommend that women take a man with them to their appointments, and they're shocked that I'm recommending this, and then they're shocked at the outcome. When they have somebody come with them, and they're like, oh, one patient, it was even that she had anxiety, and the doctor didn't believe her until her husband came with her, which I was like, well, this is a little bit opposite of what happens. But it was it's funny to me that the main thing that they have to rely on to do testing and where to go is our account of what's going on. And if our account of what's going on isn't taken seriously, then we're not going to get anywhere.
Mm-hmm. Mm-hmm.
So one thing that... Oh, go ahead. Yeah.
I was just going to say, it's just, even apart from the sort of gendered aspect of this, it is, I think, certainly also about a larger problem of medicine and Western medicine, especially, just really devaluing patients' reports and their own experience of their bodies, and really forgetting that, yeah, as you say, that we're not going to make any progress in understanding what's happening with somebody if we don't believe that they are a reliable reporter of what they're experiencing in their own body, and there's just so much knowledge that can be gained by taking patients' voices seriously in that way, and it's a shame that we have lost out on so much of that knowledge, especially when it comes to conditions that especially impact women because of these stereotypes and this history.
Well, and one thing that you touch on as well is that we don't know everything. We still don't understand the mechanism for everything. We don't understand the mechanism for autoimmunity. So to know, I think the stat in your book was that 75% of those with autoimmune diseases are women. So just knowing that, and that we don't understand all of them or how they work, we shouldn't be ignoring the complaints and the testimonies of how we feel when we don't understand all the science. Yeah,
absolutely. Yeah, I think medicine is just really kind of collectively driven by this sense of, real confidence that somehow the current testing and diagnostic tests and current theories are complete, even though, history has shown that has never been true, that, you look at this pattern of previous generations of doctors who said, ulcers are due to stress, and then, there's a step forward in medical knowledge and that those things get overturned, and yet even though we have that history to kind of look back on and learn from, it seems like collectively medicine has this kind of amnesia about that and kind of continually acts as though there is no limit and that we've already figured everything out, when that's just, obviously objectively not true.
No, and our history is always to deny that something could be different, just like the ulcer aspect, and then eventually embracing it and realizing, and in your book you talk a lot about the science behind this, and especially one of the main topics was about heart disease, because you talk about how it was men that are studied in a lot of scientific studies. Can you just talk a little bit about that?
Yeah. So I kind of, in the book, describe two main problems that I see, and the first one is what I call the trust gap, which we've kind of talked about a lot. That's about, this history of hysteria that leads to this tendency to brush off women's symptoms as all in their head. But the other big one is this knowledge gap. So there's just this lack of knowledge about women's bodies and our symptoms, that's really in part due to just many decades of leaving women out of a lot of clinical research, and studying mostly men and just kind of assuming that those results could be extrapolated to women. And it's really only since the early 90s that this issue was kind of put on the radar in the U.S., and there's been a change in federal law so that now the federally funded research must include women, and there's been some progress in sort of shifting research norms so that researchers are including both genders and doing an analysis to see if there are any differences, but there's still a lot of work to be done on that front, and a lot of that knowledge that's been gained from doing sort of research like that for the last few decades has yet to be incorporated into medical education. But heart disease is a really excellent example of how important that research is, because for the first 35 years we were studying heart disease, we were basically solely studying it in men. And as we started to look at women's experiences, we've realized that actually there are major differences that really can impact diagnosis and treatment. So women tend to have more quote-unquote atypical symptoms when they're having a heart attack. So not just the, chest pain and radiating arm pain, but nausea and fatigue and neck, jaw pain. So in part, women are often misdiagnosed or undertreated because their symptoms are just not recognized. And there are also differences in risk factors. And these days, there's actually a kind of a whole newly recognized female pattern heart disease that is still actually very difficult to diagnose, but helps explain why so many women actually are experiencing chest pain and other symptoms of heart disease, but go into the ER and kind of go through all of the standard cardiac testing, but are told, nothing's wrong, you're fine. And so it's a good example, I think, of how both that lack of knowledge and that lack of trust in women's patient or symptom reports kind of combine and really are sort of mutually reinforcing and result in a lot of women being underdiagnosed and undertreated, and ultimately a lot of women dying from heart disease unnecessarily.
Well, and I think this is common, like throughout your book, there was threads of this being very common, even if it was cancer or if it was heart disease or not necessarily dying. Those things you could if it gets misdiagnosed or ignored, but sometimes just being very, very uncomfortable and unable to live a normal life because you can't even get those things taken seriously. And if we're lacking the studies, then we can get diagnosed, but not necessarily get help or treatment for it as well.
Mm-hmm. Mm-hmm.
And I noticed,
absolutely.
And I noticed one thing you talked about in your book was not only were people finally diagnosed, but even after that, not taken seriously on their account of pain or what they were experiencing.
Yeah, definitely. I think there's a lot of focus on the sort of time before a diagnosis happens, and certainly a lot of women with a range of diseases who experience these long diagnostic delays, and of course it's super, super frustrating and scary to be sick and not know what's wrong with you. And so I think with good reason that sort of moment of diagnosis often feels like a turning point, and especially if you've been sort of fighting for a long time to figure out what's wrong with you, it's often a relief just to know what it is, no matter what it is, right? But for so many women, I think especially with chronic conditions like autoimmune diseases or chronic pain conditions or Lyme, that moment of diagnosis is not the end of that kind of struggle to be taken seriously, because, with these conditions that require kind of lifelong, often management, there's still a lot of tendency to not trust women's symptoms, and really kind of believe the tests over the objective tests over women's reports, and so you could have women with autoimmune diseases complaining of fatigue and being told, well, your blood work looks fine, you're fine, and so it's, and especially as women, we do face these disproportionate risks of chronic conditions, which can mean, decades and decades of kind of frustrating interactions with the medical system.
Well, I definitely agree, and you talk about Hashimoto's in your book, which is, whether it's a woman or a man, actually completely ignore it, even if you have positive testing. I find so in Canada anyway. It can be very significant and life-altering, and I know it affects mostly women. Can you just talk about that a little bit?
Yeah, absolutely. So Hashimoto's is an autoimmune condition that affects the thyroid and leads to hypothyroidism, so an underactive thyroid. And a lot of patients struggle to get diagnosed because the symptoms come on usually pretty gradually, and the symptoms include things like fatigue and depression and weight gain and things that especially in women, are easy to kind of brush off as just stress or, menopause. And even after diagnosis, there's a lot of frustration among patients, as you said, where the testing is often doctors really kind of focus on one single test to gauge thyroid health instead of looking a little bit more holistically at the different indicators of thyroid function and kind of taking the patient's symptoms into account. And often patients will be treated but continue to have symptoms and be told, well, your TSH levels are normal, everything's fine, even though they're continuing to battle fatigue and depression. It's I think a good illustration of this dynamic that comes up again and again in the book of just, instead of acknowledging that there's just a lot we don't know about thyroid health and that perhaps our tests are not telling us what they need to tell us, kind of just brushing aside all of those gaps in knowledge by saying, oh, well, any patient who is still experiencing symptoms is just suffering from a somatoform disorder. It's all in her head. Patients who think they have hypothyroidism but test normal, they're also just psychosomatic patients. And the stereotype just becomes this way to just not admit that, maybe there's something we don't know here and we should actually be listening to these patients and using their symptoms as a clue to kind of figure it out.
Well, and they're saying it's all in your head and anxiety and depression as a coverall for what's going on. And, not that those things may not be there, but often they're there because you don't feel good. You're anxious and depressed because you're sick, because you're not taken seriously, because you've already seen 4 doctors and you can't get answers, and your job and your relationship are threatened because of how you feel. And so who wouldn't be experiencing that? I think.
Yeah, no, absolutely. I mean, it's truly amazing. You just, the number of studies that have sort of investigated rates of depression or anxiety among patients with these poorly understood chronic conditions, and really point to that finding as evidence that, the mental health problems are causing these conditions, without acknowledging that, correlation is not causation, and it's very logical to think that if you are suffering from a chronic illness, particularly one that's so poorly understood that there isn't very much effective treatment, you're going to be really upset about it and distressed, and that's going to take a real serious toll on your psyche.
Yeah, I agree. We're going to take a quick break. We're talking today with Maya Dusenbery, and we'll be back shortly.
Opinions, options, answers. You're listening to Voice America Health and Wellness.
Take us on the go. It's even easier now. The Voice America Talk Radio Network has a mobile app for iOS, Android, or Amazon Kindle. Visit the Apple App Store, Amazon, or Google Play to download the app powered by Aircast. It's free and no registration is necessary. In minutes, you could be enjoying your favorite Voice America Talk Radio host no matter where you are, in the car, out and about, while traveling, or anytime you can't be close to your computer. Catch up on the archives you've missed or discover new shows on the spot. Search Voice America at your favorite app store.
What causes us to be sick? We're not talking about the actual illness or the scientific cause of illnesses. We're talking about your body and health. Listen for the healing whisper of return to peace. Each week, host Dr. Marianne Chase shows you how to listen to your heart to identify poor health, stress, and disease. You'll learn how to heal energetically and spiritually, as well as physically. It's time to depend less on the drugs and more on the heart. The Healing Whisper airs live every Friday at 11 a.m. Eastern Time, 8 a.m. Pacific on Voice America Health and Wellness.
Follow the Voice America Talk Radio Network on Twitter. We're at Voice America TRN. You'll get the latest fix on what's happening with our shows, this week's featured guests, and general happenings that you should know about at the Voice America Talk Radio Network. Now you don't have to miss anything when you're away from your home or office. Just go to twitter.com/Voice America TRN or follow along with us at Voice America TRN, the Voice America Talk Radio Network. We're on the cutting edge of social media. Can you keep up?
Opinions, options, answers. You're listening to Voice America Health and Wellness.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back. Today we're talking with Maya Dusenbery. She is the author of Doing Harm, The Truth About How Bad Medicine and Lazy Science Leave Women Dismissed, Misdiagnosed, and Sick. So, Maya, one thing I want to, we just touched on, how depression, anxiety, and how, of course, that will be there with a chronic illness. But I also, in your book, you talk about how women are actually affected by chronic pain more, which I hadn't realized. But I think in how we display being either experiencing symptoms we hadn't before or being in an extreme amount of pain is different than how men display it. I know for me, I can look like I'm anxious, even if I'm not, but that can be, there's this urgency to what is going on. And of course, we cry easier. We're not as stoic as men are, or that's the myth anyway. And I think that somehow that can get displayed into, well, you're or perceived, and you're displaying pain, you're displaying anxiety, so that must be the cause, instead of the cause is creating the anxiety.
Mm-hmm. Yeah, absolutely. I think this is a huge part of it. I think that, there's a really seminal article called The Girl Who Cried Pain from 2001 that looks at, summarizes a lot of research that looks at gender disparities in pain treatments and kind of reflects on where that bias is coming from, and concludes that it is that women's reports of pain are more likely to be seen as signs of an emotional problem and are psychologized, and men, when they enter the medical system and report pain, are more likely to be taken seriously and have their pain treated more aggressively. And I think definitely part of that is this sort of these stereotypes that we have that men are expected to be stoic in the face of pain, while women are assumed to be and sort of are seen as having sort of more cultural permission to express emotion about their pain, and as a result, there's this sense that if a man is complaining of pain, since we kind of assume that he's reluctant to be doing that to begin with, then his report is taken more seriously. But it's a really interesting dynamic because there's no sort of logical reason why women's reports of pain then should be undertreated and taken not seriously. But it does seem to kind of operate as if that's the case, where we kind of assume that if men are stoic, then women must be overly emotional or over-reporting their pain instead of just reporting it more accurately. And it also really shows that there's this really hard catch-22 that women are in then, because if we assume that women have this emotional response to pain, if you kind of do cry or do express anxiety or emotion around it, you might be just brushed off as hysterical, which is something that lots of women report experiencing. But if you go the opposite route and try to be really stoic, and this is certainly advice that I think is often given to women, to really try not to cry, to be really matter-of-fact about your pain, and basically try to be more like a stereotypical guy about it, that also runs a risk that you will just be seen as, oh, well, nothing's wrong, because we don't expect that response in women. And so I include in the book a story of a young woman who was experiencing severe abdominal pain, and was saying that it was really severe, that it was the worst pain she'd ever experienced, but was not particularly emotional, was not crying. And because of that the doctor clearly was underestimating how bad it was, and she nearly died when her appendix ruptured. So it is this, I think, very difficult balancing act of how exactly to express your pain or other symptoms without falling into either of those traps.
Well, and just to go back to the example from the first segment that I talked about of the two patients, the man and the woman that went to emergency, I had a conversation with the woman about how she felt she should have behaved and what she was doing. And this came to me because of that interview I did with Abby Norman. She had this whole paragraph when she went to emergency. Did I rate my pain high enough? Did I rate it too high? Are they going to take me seriously? Am I showing the pain enough? Am I showing? We go through all these things. Are they going to believe me? It's like we're playing this juggling act of, if I'm upset, then they're going to think I'm hysterical. And this woman, when she went to emergency, she had denied the morphine they offered, even though she was in enough pain to sit in emergency for 8 hours, and she'd never had this pain before, and was eventually actually diagnosed with interstitial cystitis. And she didn't want to take the morphine, and she feels like that played into some of it because she wasn't in enough pain to take treatment, so she shouldn't have been taken seriously. But she'll never know that. I've felt this as well, especially when I was looking for answers. How can I get them to take me seriously? What should I display? Should I cry or should I not cry? Should I, and I don't think that's right either. I think we should be able to go in, and if we need to cry, and if we don't, not, and and just experience what we're experiencing the way the men do.
Right. And I mean, that example of the woman who denied the morphine is perfect, because you can also imagine that the exact opposite response could also be used against her. If she seemed too eager for the morphine, she would risk being seen as potentially just drug-seeking and making up her pain entirely. So it's, again, another case where it's totally unclear which way will get you the treatment and care that you are looking for.
Well, and in the end of your book, you talk about how there really isn't a way. There's one story you were telling, and she realized it didn't matter what she did. It was just going to be this way. And really, the shift needs to happen within the system, not within the individual patient. Right now, we just need to survive so that we can get the help that we need. But in the meantime as well, we need to advocate and do, books like this and shows like this so that people understand what's happening, and eventually this changes.
Yeah. I think it's been challenging in these interviews I've been doing to kind of walk this line of wanting to certainly encourage women to be their own advocate and do research and feel sort of empowered to get a second opinion. And I certainly do hope that the book, just by kind of providing some of this background and history and the hard data, will help women feel free to do that and give them a bit more kind of sense of a healthy skepticism about the limits of medical knowledge and not just accept it if somebody's telling them, oh, nothing's wrong, or it's just stress, if you know in your bones that it's not. But I do think it's very important to recognize that this isn't a problem that can be fixed by individual women just becoming more empowered, in part because of all of these catch-22s we were just talking about. And it does require that in order for this to be fixed for everyone and not just those patients who have the financial or educational resources needed to kind of be super patients, this really requires systemic change and requires people within the medical profession and within the research communities to first acknowledge that this is such a huge problem and then really commit to finding ways to fix it.
Well, and so what can someone do if they want to work for change, especially where they are? Is there something that they can do?
Yeah, I mean, I think there's certainly a lot of potential for sort of grassroots patient advocacy around increasing funding for a lot of conditions that especially impact women and have been really neglected in the research realm. And so I think that's a really promising avenue. Also, patient advocacy, I think, can help in demanding changes to medical education so that doctors are getting more education about unconscious bias and putting systems in place so that doctors are getting more feedback about diagnostic errors, because I think that's a really big part of the problem and part of why it's become really kind of self-perpetuating, where doctors just don't know when they get it wrong often. But I think, for just the most basic thing that women can do, I think, is just tell their stories if they have them. I think there's a lot of power in women seeing that other women have similar experiences and kind of having that moment of realization that it's not just me, that these experiences are not just the result of individual bad luck, or even, I think a lot of women assume that, maybe I could have done something more to advocate for myself. So I think there's a lot of power in seeing that, no, there's a pattern here, and these experiences are reflective of these larger biases within medicine. And I think that kind of storytelling can also be really powerful in showing healthcare providers that this is an issue. Because, like I said, I think that at this point it's sort of a bias that flies under the radar a bit. And doctors, I think, need to first just realize that this is more widespread, I think, than all of us assume.
Well, and I agree, and even if we advocate for the education to change, the doctors that have already gone through school still need to understand that this is an issue. And I know that we can all understand this by reading your book. So can you tell us how people can get a hold of that or get any more information if they want it?
Sure. You can check out my website, which is mayadusenbery.com. And that has links to where you can buy the book, which is available wherever books are sold. It's also available as an audiobook. And there's a variety of additional articles on my website that kind of touch on a lot of related topics, because I found after completing it that there was still so much that I had learned in my research that didn't even have space to include in the book. So I'm still working on additional articles to draw attention to some of the particular problems.
Well, perfect. Hopefully I'll have you back on the show.
Yeah.
Thank you. Yeah. Thank you so much for joining me today. I absolutely loved this conversation.
Oh, thank you. It was a pleasure to talk to you.
And if anybody listening wants more information about my story or my health journey, you can go to my blog site at dr-risk.com. You can also filter shows by topic if you're wanting to find Abby Norman's show from March, as well as don't forget to follow me on Facebook, Twitter, or Instagram. And also be sure to make today a great day. Thanks so much for listening.
Thank you for tuning in to this week's edition of Falling Through the Cracks. Feel alive and thrive. Please join Dr. Rebecca Risk again next Monday at noon Eastern Time and 9 a.m. Pacific Time on the